Hello there and welcome to Turó Talks Face to Face with me, Carrie Fraze, and today we're going to talk all about teeth. Our teeth, of course, are the product of hundreds of millions of years of evolution. They're important for eating, for speaking, for our self-confidence, and of course for our overall health, so we need to take very good care of them. Well, with me today are three dentists, each with their own specialism, who have a lot to say about the world of dentistry and the profession they love, and who are also going to share some tips and tricks about how we can all have the very best teeth possible. So first up, I'm delighted to say that once again we have the founder of the Turó Medical Centre and Dental Centre, I should say, Dr. Madeleine Smit. As well as being a successful entrepreneur, you're also a highly experienced orthodontist, aren't you, Madeleine?
Well, I've had many years of working and perfecting and learning.
Great. Well, welcome and thank you for coming on the show again.
Thank you, Carrie, for having us.
And we also have Dr. González, a pediatric dentist. Welcome, Laura.
Thank you very
How
much.
are you?
Good, it is a pleasure to be here.
It's great to have you. And also we have Dr. Eléna, a dentist originally from France, as you can tell from your surname, and who specialises in restorative dentistry, endodontics, prosthetics and aesthetics. I definitely need my teeth in to say that right. Okay. How are you, Eléna?
Hi, how are you? Good.
Great, thank you. Laura, Eléna, we'll be speaking to you shortly, but Madeleine, I'd like to start with you first. And my first question to you is, do you think people underestimate the value of their teeth?
I think it's, there's different age groups have a different attitude. I find when I look at the patients that I've been meeting throughout my years working, I find the younger generation are much more, they're growing up taking much better care of themselves, the whole concept of self-care, and they look at themselves a lot more, with a lot more critically. There's all this information out there, they know how to get it, the information knows how to get them. So I think the younger generation is aware of the importance and aware of the things that can be done, of what's out there in terms of prevention or enhancement. But I find people more in the 30s, 40s and above age group, they often are not aware that there's still so much we can do. Little things that can make a big difference. I think there's a lot more, they're much more quick to say, well, at my age, you know, that's not necessary anymore. And I think they're missing out on the little things that we can do that really make a huge difference and can really freshen up a smile. They can give back function, accompany aging in the best way, so that there's a lot of things which we will talk about. There's a lot more in the dental profession that involves smile rejuvenation, and there's many techniques that doesn't just involve the teeth. It involves what we call the soft tissues, the gums, the lips. So I think there's a lack of information in the older age groups, and that we'd like to transmit, because there's very exciting little things that we can do that make a big difference.
That's why we're here today, to impart that information, of course. Well, some of our viewers and our listeners may not know that actually the Turó Medical Centre was originally a dental centre, wasn't it? So why did you decide to set it up in the first place?
Well, it was never only a dental centre, but it started out where I was looking for a space where I was ready after many years working in different hospitals and clinics in different countries. I wanted to settle down. I was ready. I felt confident enough to, to do it by myself in my way in orthodontics. And then I wanted to share my work with other medical professionals that spoke English. And so I wanted to set up a medical and dental co-working. I never wanted it to be fully dental. But yeah, the idea was that I was just going to work with one of our other colleagues, Dr. Filippi. She would just take care of the bits that would accompany the orthodontic treatments, and then I was just going to do my orthodontics and rent out the office space, for doctors that spoke English. But it kind of evolved.
Yeah, and where we are now, amazing. amazing. And you offer pretty much everything, don't you, to do with teeth, from regular checkups?
Yeah, well, we've got an incredible team, and I'm very excited because it isn't easy to find a good team, but it kind of it took some trial and error to find one or two great colleagues who would then recommend great colleagues who often some of them are professors at university, and so they would then recommend the star students, and so gradually our team has grown into, and I really can say this without any hesitation, and I'm not even ashamed to say it, we really have top professionals. We really have some amazing people working in our team, and it's just getting better and better because as they recommend amongst each other, the team is growing. And the great thing is that because everyone's sort of coming through a recommendation or with a similar background, we have a very similar way of working. It kind of flows. There's we all get along, we have our same criteria, so yeah.
How incredible. And where have you seen the biggest growth area, would you say, in recent years?
In dental care, I think, again, I think there's a generation coming in of people who are very aware of prevention and maintenance. Aesthetics is always growing. I think, again, people are increasingly willing and aware that they can invest in improving their smile. But having a healthy and nice looking smile makes a huge difference in your face.
Yes, so rejuvenating.
It really does. It really is. I think before anything else, I think it makes a huge difference. And you can be wrinkle free and have the perfect hair and have so much done. But if the teeth aren't looking healthy and well taken care of, then it just it makes a big difference.
Yeah, and how much would you say the state of our teeth has changed, say, in the last 100 years or so?
Well, I think, if you go back maybe 50, 60, 70 years, the main problem was decay, tooth decay, cavities. And also the materials that were available at the time, the only thing they were capable of doing was filling a hole.
Yeah.
Then adhesion came, which means we could stick stuff to teeth, which meant that repairing them, the professionals could be a lot more conservative. Right. They didn't have to remove healthy tooth tissue to create something that would mechanically hold the material in place. I think now the problem also, people are holding on to their teeth longer. Yeah. We're aging better, but the majority of the problems we're seeing, and I think Eléna and also Laura will talk about that, is that we're seeing much more problems related to wear, what we call attrition, so bruxing, but also the effect of some energy drinks, soda pop. So we're seeing much more damage that is different to cavities. I think nowadays cavities are still happening, of course, and I think a lot of it has to do with education. It has to do with education from a very early age, what is being transmitted at school, what is being transmitted at home. It's about access to information, simple things. But then what we're still seeing more and more of is quite serious damage because of stress and because of the energy drinks.
Yeah, so to touch on that, about things, we all know about the sugary drinks and sugar in general and the effect it has on teeth. What about lifestyle habits? What changes could we all make?
Well, I think, and again, the pediatric dentist really is the number one educator in this. I think there's a misconception that you cannot eat, don't eat sugary foods or don't eat cookies because they're not bad for your teeth. It all depends. If you brush your teeth, you're fine. And it also has to do with how many times a day and how you combine that intake of sugar. And actually, this really goes for your general health. If you snack all day, little bits of something sweet, but a small amount, but you do it every half hour. Basically, when you take in sugar, the pH in your saliva, it gets acidic, and that's what really attacks also the enamel. So your saliva then has the role to neutralize that and create a safe zone for your enamel. Yeah. But if you keep bringing that down, if you don't give your body enough time to get back to a neutral pH where there's no damage being done, then that's really the bad part. So you could eat a whole box of candy at lunchtime and brush your teeth afterwards and not do as much damage than if you eat maybe, little bits of sweet, but you do it very regularly throughout the day.
Yeah.
So basically, eat your cookies have your dessert at mealtime, have your sweets with meals, and brush your teeth after each meal.
If you want them at all. Or I'd say if you have a big box of candies, it probably has a knock-on effect
so
on the body.
I think that the sugar in itself is not that bad as long as you have good oral hygiene habits.
Okay.
Yeah.
What about technology? How have you seen that evolve over the last decade or so?
Technology has made a huge effect, not only just in what we call material science. So we've got smarter materials that we use so we can create tissue, substitute for missing tissue. As far as fillings and even regeneration of soft tissues. We've got lots of so the development in bioengineered materials has made a huge difference. And of course, the other thing that's made a huge difference in the way we work is how we can now we can scan. We have 3D radiography, which has made a huge difference. Our 3D scanner isn't just used before we place implants. It's used for root canal treatments. It can be used to localize cysts it can be used for many things. I think we're using those 3D images where you get a much more predictable diagnosis. We can check better on the treatments that we're performing, whether they've been done correctly, whether they need additional intervention. So 3D radiology and 3D imaging is the 3D imaging is what's replacing or has replaced the traditional method of making molds. It hasn't disappeared because for certain things they're still better. So it depends, and then of course people have different opinions. But 3D imaging in either radiology or just visual imaging has made a huge difference, because from that you can 3D print, you can 3D cut, so you can have a lump of ceramic and you can then, I don't know how you say this.
Mill it.
Yeah, you can mill it, that's the word.
Right.
You can mill
amazing.
ceramic, so you make the design on your software and then you just produce it. And so you can have same-day crowns, same-day veneers, you can have same-day temporaries.
Incredible.
Yeah, you can make your own aligners like Invisalign. You can do,
You can't imagine what could better that, but is there any technology in the waiting?
Well, within that, things can be improved. I think within those technologies, there's still room for improvement and to make them better, to make them more precise, to give us maybe a larger scope when it comes to milling. I think color is still,
probably like with the algorithms that they have implanted right now, it's hard for like a dentist to actually work it. It's more guided towards the lab technician. Probably in 10 years, we will be able to just with a click and the algorithm create our own.
I want A2 shade with a little bit of this and a little bit of that to make it, No, of course, there's still room for improvement.
For sure.
It's you can have a 100% digital workflow from diagnosis to the actual repair placement of a crown on an implant.
Incredible.
It can be 100%.
Because you can have video consultations as well,
Also,
because that's where it starts.
Yeah, also, of course.
Incredible. I think my last question to you at the moment, and before we move on to you two, is just about financing, because a lot of people may be put off about having worked their teeth because of prohibitive costs, but you offer financing.
Well, there's many studies that show, and again, this is changing. There is a shift as the younger generations coming in with much more information. That the two main factors that stop people from coming to the dental office is the fear of cost and the fear of pain. And I don't know which one comes
about root
first.
canal later on.
Yeah, it's two different. But again, the pain control, pain management, and the technology and the materials, all these things means that really, it's pain-free dentistry. Dentistry has become what I think in the profession we call a clean profession. Like there's clean in the sense that there's no blood and shed, and there's no there's no horrible things that happen, because the way things can be done and the way the materials allow us to work it's like a clean job now. It's blood free.
Yeah.
And financials are super important. So It depends. We do work with a company that can offer finances for the short-term treatment. So if it all depends on the treatment plan, and we do personify. But basically, there's two ways. Either for something like orthodontics, where we know we have about a year and a half treatment duration, we just spread the amount over the time period of the treatment that we expect. So you can spread the amount over maybe 18 months. When it comes to shorter treatments, what we do is then we work with a partner that can finance. At the moment, I think we're at 3-4 months. But as we develop our partnership, that will probably be able to be extended. I think it's very important to understand that some of these treatments they have a certain cost. Something I'd love to talk about more because I think it's very relative.
Yeah.
I think but then it is, of course, everybody has their monthly budgeting, and there's always ways.
Yeah.
There's always ways to adapt. Yeah.
Okay, great stuff, Madeleine. We'll speak to you a bit later on. Thanks so much for now. Laura, we'll chat to you now. Laura González, you're a pediatric dentist. Just to clarify, a pediatric dentist works with children up to what age normally?
Okay, so we typically see children from a range of age from 6 months old until their permanent teeth come out.
6 months. So that's the age when a child should first come to the dentist. Is that the case?
I mean, it's not always the case. For the American Pediatric Society, they established that the first time that a child should always visit the visit is the first time that or a teeth comes out or the first birthday.
Okay.
Always. Yeah.
But are you seeing babies?
Sometimes, because parents get concerned about the teeth coming out. They're like, oh, this teeth here is a little bit yellow, it's a little bit, and they get concerned and they come here. They're like, what do we do? Sometimes we can offer treatments, but most of the cases we just wait until they are a little bit older.
I always think it's amusing that children think that they're never going to get their teeth come through. You get one through and they think that they're waiting and that there's no others, but obviously teeth eventually always come through, right?
Yeah, and what I've seen lately is they always get surprised they have more teeth coming out.
Yeah.
When I show them like the radiograph, they're like, oh, I do have all those. Yeah, you do.
So what are the main issues you're seeing at the moment with children's teeth?
At the moment, the major issue is dental caries.
Yeah.
For example, here in Spain, 31% of the children below 6 years old, they present caries. That's a lot, yeah. So that has a lot to do also with the first time that the parents take the child to the dentist, because if we see them at the right time, we can prevent the dental caries. Because there are some studies that show that every time you delay that visit, that first visit or that checkup, you double the chances of getting dental caries.
And at what age are you seeing caries among children?
8-9 years, a lot of caries. I don't know if it's because that's a change where the age where they start like brushing their teeth, and probably not their parents don't try to leave them alone to do that kind of stuff. Also, they go to school. Sometimes in school they don't brush their teeth.
Right.
So there are a lot of factors.
I think that's a major issue, which I've never understood. Why the schools they teach, they are in such an important position. The kids spend so much time at school that there is no education. They don't even often let the kids brush after lunch.
So it's not enforced in the schools here.
And the habit's not installed. So it all needs to be done once they're an adult.
Yeah. Because you would recommend presumably morning, lunchtime, and evening for it.
Every time you have food, just brush your teeth.
Yeah.
Because when they're this young, like this little, there's a very high risk of getting dental caries. And sometimes they're like, no, I don't want to brush my teeth because I just want to go directly to play football. I'm like, no, please just.
Because I think there's misinformation. Sometimes I hear parents say, oh yeah, but it runs in the family. No, it doesn't. You don't get cavities if there's no food in the mouth.
Right.
You just don't get it.
Yeah.
It's the combination.
It's the combination of just eating the wrong foods and not brushing, or not necessarily the wrong foods as you said, just eating and not brushing.
Bread sticks nice, or cereal sticks into the molars, or people brush before breakfast. is also interesting.
Yeah. So
Because
just brushing at the wrong time. It's funny.
Doesn't
isn't
make
it?
a lot of
think-
sense.
yeah,
The
I
whole
think it's
point
like
of brushing is to remove food remnants.
Yeah.
If you don't have food remnants, you don't get cavities.
Yeah.
And mouthwashes don't do the trick, right?
You need to mechanically.
Yeah.
Oh,
Yeah.
No,
It's
you need to mechanically
Yeah.
remove all the food left.
And do children need to floss as well?
Yeah.
Yeah, okay. I mean, that's something that for any parents watching this, it's really interesting
Yeah.
because that's certainly when I was
It's-
growing up something that wasn't taught, but I
it's
recognise now.
all about education.
And more to the parents rather than the children, because the children at the end you're gonna explain them, but
Yeah.
you're gonna prefer what I've said, going to the playground to play football before brushing their teeth. So you really have to sit down their parents and talk about to them about a good brushing technique, when, how, all this stuff like really has to do with the prevention.
Yeah, because healthy habits start young.
Exactly.
Of course. Yeah, so fittings are the way that I would presume one treats caries, but presumably it's not the only way, is it?
It's not the only way. Well, we have to look when a patient comes to the clinic and the first visit basically, or a checkup, is what's the risk of the patient of having caries? Is it low? Is it moderate? Is it high? So depending on the risk we're going to offer a treatment or the other one. Fillings are the most normal ones, but for example we offer crowns, which are stainless performed crowns of stainless steel. And we put them in the temporary teeth, in the molars, to prevent this type of caries. Also, there are a lot of other treatments such as atraumatic restorative treatments, which is to remove the caries with manually, basically. We don't use rotatory instruments.
And no anesthesia.
And no anesthesia, so it's perfect for the kids because they are not gonna have that dental fear afterwards.
That's really interesting you talk about removing the caries, because people think caries as a whole, don't they? But what are you actually removing?
I mean, we're removing, the caries does the whole, that's the thing. So that's a conception that should be clarified to the parents, because they're like, okay, but I have this stain here, is it a caries?
Yeah.
Sometimes it's not a caries, it's just a stain, and that's what also another scene I found in the clinic usually.
Yeah, very
The cavity, it's the bacteria.
Yeah,
really.
exactly.
Right.
Yeah.
Exactly, and that's the confusion, I
Well,
think.
it's the bacteria that feed off the food that you leave them, and they then have, as they process that food that we leave for them, they multiply. Also, they're super happy. They multiply, but then they also produce acid as a byproduct in their digestion.
Acid making.
And it's the acid that's attacking the enamel.
Oh, interesting.
It's not the bacteria that chew away on the enamel.
I actually think as a vision that would work really well when you explain that to children.
It's
idea
like
these little bacteria-
the acid in urine. Look what happens when dogs pee on the tree, on the plants.
Oh yeah,
That's
exactly.
exactly what bacteria do in your mouth.
Yeah.
Interesting.
When I'm doing a filling or something on the patients and they are very young, I explain to them,
Okay.
you have like bacteria, they're like little monsters that are just like eating your teeth, so we just need to remove them.
Yeah.
And I'm doing the dental, and I'm almost done. I'm almost removed all the bacteria there. So
brilliant.
they kind of understand something because they don't associate like the risk of.
And I think maybe it's important, it's a question that I've heard many times, is that some parents think, well, it's a baby tooth.
Yeah.
Do I need to fix it? I mean, it's going to fall eventually anyway.
And it's about presumably that's true, that it's about getting into the right habits.
No, exactly.
Well, it is important because the baby teeth are also, they keep the space for the other guys that need to come. And if you lose those early, you create problems later on.
Exactly, space and then ortho.
Yeah, but also, the populations expand those type of bacteria, then increases the probability that you'll get cavities in other areas.
Yeah, in the future.
Right.
Yeah.
It's really also depending on how deep a cavity can be on a baby teeth, it can actually affect the permanent tooth that's about to come out
as well. Okay.
So
So
sometimes it actually comes out damaged.
Really?
Exactly.
That's true.
Yeah.
That's why it's so important too.
Yeah.
It is extremely important to take care of your baby teeth and see the pediatric.
Yeah.
For many reasons. If for whatever reason they do have a cavity, what is the best fitting that a child should have?
I mean, it depends of the risk and the treatment that the patient needs at that moment.
Right.
Just depends.
But if I can offer the best treatment, it will be a traumatic removal of the caries. Because as we've said, it doesn't involve anesthesia, it's not painful. You're not gonna have that dental fear of the dentist afterwards. Because I have a lot of patients here. I mean, they're little, they are scared. Imagine a woman just comes up with a mask, making a lot of noise, with a needle. They're like, where am I? What are you gonna do? And of course, if you treat them, try to be the less, just try to remove them carefully and manually. That's the best. I think that's the best option, and that's the best.
And what about fillings though? Amalgam fillings, are they still used?
I mean, for example, here I don't think we use them anymore. In Spain,
they don't teach it. No,
they don't
I'm
teach
from a different generation.
Yeah,
I won a Amalgam prize, which is just awesome.
Like
the
here,
worst. Yeah.
I think the new generation of dentists that are coming, they don't longer.
And what do they teach you with amalgam fillings? Because I was taught that they removed it because it was an environmental issue more than a health issue.
Same thing for us.
It was the amount that you accumulate in the clinic and how we get rid of it. We have filters because we do remove amalgams. That's another thing. We remove them and replace them if people want or if it's necessary. And we have special filters now that we need to have. I think by law. By law we have filters in our system so that we have to separate the amalgam from the other waste. So it's an environmental issue more than anything.
But besides from that, also the wear makes you ingest bits of amalgam,
mercury.
And there's all sorts of issues associated with that.
But we don't use it. We haven't. I've never worked. I think I only had it at university 100 years ago. We never used it.
Right, so it's slowly being phased out, I would imagine. No?
But they age pretty well. Sadly,
they last. Which is why they've been used for so long.
They last, but they're awful and they're ugly.
They're very ugly.
And they don't stick to the teeth. See, this is really a big difference with the new materials, where you have a seal with the tissue material and the filling material, whereas amalgam doesn't stick. It just fills, and then it sort of expands a bit, and it fills the hole. It has very different properties.
Sure. And Lara, what about oral conditions associated with certain diseases, like diabetes or asthma, for example? Do you diagnose those as well, or are you aware of them?
We don't diagnose them, but we could suspect there's something happening with the patient. Because, for example, in the case of asthma, there are like oral ulcers and other like clinical signs, not only oral ulcers, of course, but that may suggest that there's a problem. In the case of kids, for example, there are some studies that suggest that there's a little bit of more erosion in the dental tooth. In the case, for example, of diabetes, it's about how the gums are, about just a lot of things. The saliva flow rate, the dental decay, if they show, as I've said, gingival, periodontal disease, oral lesions, all of them, they make us suspect probably of the combination of several factors.
Right, so you might be able to diagnose something before the actual patient knows about it.
It also it's not only about like asthma or diabetes. Sometimes it also involves psychological factors, like how they behave in the clinic. Like it happened to me a long time ago. I had this patient that came to the clinic, and he was showing signs of autism. And I remember I spoke to her mom. I was like, "Is everything like how is he behaving at home? How's everything?" She's like, "No, she's just like super scared of everything. Strange noises. I don't know. She's just like that." And I was like, "Okay, probably like let's see in other visits how she acts." And let's see if there's any other sign that makes us suspect of this, And I remember there was, and I spoke to her mom, and I was like, honestly, I just think there's another thing that's making your child behave this way. So probably you should need an evaluation.
And then it was.
It was autism.
Wow, I mean that's interesting, Madeleine, isn't it? That you've got people on board here in your clinic that are able to see, different issues
because in all these the diversity in dental care is such that you really do need in your team specialists, because there's so much more, and we're so much more aware of the connection with our general health, and sometimes you are in the perfect place to be the first person to spot something, such as mouth breathers, who may have problems just that are more ear, nose, and throat related, and you can detect many things. So
yeah. So my final question to you would be, as well as teeth brushing, what other ways can children make sure that they have good oral health?
That's a thing. As we've said before, brushing your teeth straight after having sugary foods. You can have them, but just brush your teeth afterwards.
Yeah.
Having, for example, in our case, if the patient has a high risk of having caries, we can do dental sealant, which is just putting a little bit of composite in the fossas of the molars, so food doesn't accumulate there, and there's a less risk of having caries. Also, the fluoride that the intake of fluoride that the patient with the water, with the toothpaste you're using, all of this also help to prevent.
Just to clarify, because fluoride's a big topic.
Yes.
We are talking about topical, meaning it only affects it's not the swallowing of the fluoride. It stays outside, it doesn't get swallowed.
Exactly.
It's very important because
sometimes, when the patient comes and they have a high risk of caries, we do the dental hygiene and everything, and after we just put some fluoride to make the enamel stronger and have less.
Right. And presumably just keeping healthy has got to be something that we all need to do to keep, obviously, to be healthy all over, but including teeth.
I think anything that's good for your general health is definitely going to be good for your oral health.
Exactly, brilliant. Well, thank you so much, Lara, for talking to us. We'll come back to you right at the end, but I do want to speak to you now, Eléna, originally from France. You specialise, as I've said, restorative dentistry, endodontics, prosthetics, and aesthetics. That really is a mouthful. I don't know what endodontics is, so I'd love you to explain what it is first. Thank you.
Endodontics, actually, we have a specialist here at the clinic, so I don't take care of it anymore.
Right.
She's the one that does all the endodontics at the clinic. Basically, it's a specialty where when usually a cavity goes deep enough that it affects the nerve, that's when the specialist comes in and does what we call a root canal. Everyone knows what a root canal is. It scares everyone, the word scares everyone. But it's basically just removing the nerve part of the tooth to make sure that the patient is not in pain anymore. It's not like removing the full tooth. It's actually the best way for us to keep a tooth in the mouth. Right. Some people think that it's going to affect their teeth, but it's actually the nerve of the tooth. It's useful up until the root is formed, and then it doesn't have any use into the tooth well-being, let's say. It's just involved in formation. So removing it, there's no risk at all. The tooth may have a higher risk of fracture, but just the corneal part of it, so we just cover it up, and basically it's not that big of a deal.
That's interesting. There must have been an original reason why a nerve was there or is there. No,
it's what helps the root form.
Right. Okay.
So up until its formation, it's super useful, obviously. But once the tooth is up and formed and the roots are closed and everything is done forming, it loses its function.
Interesting.
It's still there, but some people say, but then I'm not gonna feel my teeth, and I'm like, do you feel your teeth? You're not supposed to be feeling. Of course, you feel a bit of cold, a bit of warm, but it's not necessary for you to feel cold or warmth in your teeth.
No, so the rest of your mouth can do that for you.
Exactly.
And what about periodontics? How does that differ from endodontics?
So periodontics, it has to do with the surrounding tissues of the tooth. So gum, bone, periodontal ligament, everything that is around the tooth has to do with periodontics. We also have a specialist of that at the clinic. We have a specialty of everything. And it's just they make sure that the gum is healthy and that we maintain a good level of bone, which is basically what holds up the tooth. So it's very important.
Yeah.
Yeah.
And also, they when there's problems, there's increasing more techniques to regenerate bone, to regenerate gum tissue. We can do gum grafts when there's been a lot of recession. We can do it on one tooth. We can do it across several. It can be from the own person's tissue. It can be what we call allograft. It can be synthetic or denaturalized
How interesting.
tissues.
Because you have receding gums naturally as well, so that's something that you could treat on an aesthetic basis.
Yeah, exactly. It's not just for preservation and conserving the dentition for as long as possible in the best way possible, but also to aesthetically, depending, some people show their gums and they smile, some people don't. So there's lots of ways. It's I mean, the perio, the tissues around the teeth are important to keep our teeth.
Yes,
Definitely.
You mentioned root canal surgery, and you mentioned how it instills fear in a lot of people, adult or child. Firstly, just explain why you would need it in the first place.
So usually it can be because of a big cavity that reached the nerve, and so if there's a series of diagnosis tests that we do to see whether or not the nerve is affected and whether it can come back from it. When it can't, unfortunately, it means that we need to do the root canal. So it's basically, when I try to explain it to patients to make sure that they're not afraid of it, I just say it's a big cavity. Instead of just removing the cavity that's in the crown, we go a bit deeper.
Right.
They don't need to know really the details of what it entails. Just know that you're going to lose the vitality of the tooth. The tooth is not considered vital anymore, but there's no risk for the patient, and actually is better than removing the tooth altogether. You're maintaining your tooth in your mouth, which is the goal. So yeah, that's why.
And quite straightforward surgery, not too painful, just to reassure anyone that's
no, it's we use local anesthesia.
Just like for a cavity.
Exactly, it's the same.
Okay.
It's not more painful. It's not more invasive. It's just a different type of treatment, and it's less known and thus more scary for the patient than just a cavity. But in the end, it's.
I think about it. The endodontist does only this. So the specialist will see maybe 10 1-hour appointments, or maybe 10 them up 8.
She
gets
sees
there. And this is what she does every day from Monday to Friday, and this is across the world. I mean, root canal treatments, maybe we do as many root canal treatments as fillings. I don't know what the numbers are, I have no idea, but I think it is just, and again, I don't know if there's the demographics, if it's sort of any age group that is more.
I'm not sure, because
it's not, we get
there's
all
also
ages.
different reasons why we would do a root canal. You can do root canal because of a trauma. So there's kids that have root canals, but it's because the tooth suffered a trauma where the nerve also reacted in a
so
way.
It's something that's going to be there forever, and the ways it's improved is, of course, our anesthesia. Once the anesthesia is done, that's it. You can just relax, listen to your music, and let go. Because also, in order to make sure that of course we don't get bacteria in that area, they work with like a plastic sheet that covers like your mouth, and only lets that tooth that is being worked on pop through. And patients just you can just drift off.
A lot of patients fall asleep. A lot of patients fall asleep.
Really do that?
Yeah. If you're a busy mom.
If you want a root canal, you get some rest.
How long do you get?
An hour.
An hour.
Yeah, it's
Not
pretty
so bad.
good.
Great,
Pizza massage. No, the thing is, it really is. It's really that simple, and they work with either microscopes or loupes, and because it's a very delicate. Sort of, it's like it's a very, very precise little job with millimeters, fractions of millimeter measurement. They check up on the x-rays to see if everything, and it's quite nice. If you look on the x-ray afterwards, they look like jellyfish.
Yeah.
You know? So it's evolved usually. When I graduated, it was the one thing I didn't want to do, because we didn't have mechanicals, we didn't have the right instruments that they exist now. And it was not a fun job to do, and now it's just become
like a fine art by the sounds of it.
and you're left with really it's much easier to do a great job, but you need to be specially trained to do it properly.
Definitely.
Let's talk a little about prosthetic dentistry. So many different procedures, aren't there?
Elena's favorite.
Crowns, bridges, dentures, veneers. can you, I mean, it's a big question, but you could rattle through when you would need what?
Of course. The implant, it wouldn't necessarily go into the prosthetic procedures. The crown that goes on top of it does. The implant itself, it think of it that it replaces, it's like a screw that replaces the root part, which is inside the bone. And then the prosthetic would be putting a crown on top of it, which would be outside and simulate the crown in your mouth, basically. Implants are used when we're missing a tooth for whatever reason, and in order to replace it, we simulate with a screw with the implant. The crown, it's used when we lost tissue on a tooth, and we also want to restore it to its original shape and restore its function. So that's when we would use a crown. Usually we use it when we lost quite a lot of tissue. Otherwise we try to be a bit more conservative and use either what's called an onlay or an overlay. It's made of the same material, but it's just less invasive. And as Madeleine was saying before, today the technology allows us to do some prosthetics that don't need any mechanical retention, because it all goes with the adhesive. So it basically just sticks to it, and it's way less invasive.
I think that's the number one revolution in dentistry.
Definitely.
Right.
Yeah. Okay.
Definitely. And then there's the veneers.
Yeah.
These are fully aesthetic treatments. They replace the outer part of the tooth. And same thing, it's very, very conservative. It's minimally invasive. Today we can drill as little as 0.3 millimeters of tooth to be able to stick a veneer on it. So
it's like a contact lens.
Exactly.
Yeah.
Exactly.
There's the tooth like it. I mean, these are all procedures that are to do with, and this is a phrase that you have introduced me with, smile beautification. Isn't
Exactly.
It? And just
function.
Yeah. Well, exactly. It's a two-in-one.
Well, we're the combination of the three of us is what really works.
Yeah, amazing.
Because Lara is really great with fillers.
Okay. As in the fillers, the more aesthetic related fillers that we're talking about. Okay, so how would you use those?
Okay, so as dentists, it's perfect, right? Because we can modify the shape of the teeth, we can give them another color, we can give them another position. But what when we're done with the teeth? You know, probably the patient is not happy with, when they smile, probably the lips, they don't like them, and that's where I come. Because for example, I also do lip fillers as well. So some of the patients, they have a gummy smile, but like super little, and it's something they don't like 2-3 millimeters, because they have super thin upper lip, right? Or an M shape, or a shape they don't like, basically. And we as dentists are also able to address those problems and give them and raise their self-esteem, and that's what I
think that the boundaries are shifting a little bit. Of course, you always need your specialists. You always need. There's areas that also legally we cannot touch because we are not trained to touch other. That's why I think Botox is an interesting one. Again, I'm a different generation, but I also find that we can do certain parts, but we can't do the upper face.
Exactly.
And then as a patient, as a person, I would think, we would just see somebody who can do everything for that part, but then we use Botox a lot for other reasons, such as bruxing, not so much for aesthetics, but then there's many things. So I think there's been a huge shift, and I think maybe this is the other sort of, maybe not revolution as such, but there's a shift in how we look at patients. When 30, 40 years ago, or even 20 years ago, we looked at the bite and the teeth. We didn't look at the smile, the function, but we didn't look at the smile. We didn't also take into account how smiles change as we age. Our lip position is different when we're 16. The amount of teeth that we show at 16 and which teeth is different from when you're 50.
How is that?
Well, because
Gravity.
And muscle tone.
Right.
And also our skeleton is constantly remodeling. If you look at where the sockets are placed in a fully grown adult at age 20, and if you could superimpose, and they do, you can find this probably on the internet, and see how the position of your socket is different. So, and this is important when it comes to just aesthetic medicine and aesthetic surgery, and you know that it's not just the skin sagging; it's just the hanger underneath it is changing as well.
Yeah.
And so when we work in dentistry, we are taught that okay, whatever you're offering now as a treatment plan, think how this is going to age.
Yeah.
And
Yeah,
I
I
think
think
that's changed.
The great part also that she was saying is that sometimes, I mean, she says sometimes they don't like, but sometimes they don't even know what they don't like, and they
Yeah.
just say like, I don't like my smell. And you can correct the teeth up to a certain point, but if they're not showing their teeth,
Yes.
that's where she comes in, and she can do
Right.
the fillers and actually make the other treatment make sense, if you know what I mean.
And there's
So-
other things that you can have. You can have a short upper lip, and you can
Yeah.
have gummy smiles, and all those things can be then referred. I think the first conversation to have with a prosthetic dentist or like Laura, who has really taken an interest in education, especially in lip fillers, but is to say, okay, well, you know, what is it to be the first people, and then you can refer and say, well, the problem that what you're not liking is because of this, and then we that's why we have a great team.
Yeah,
Yeah,
And we
that's a good
connect
thing.
with and we connect with the medical and the aesthetic team at Turó Park when we address aesthetic issues. And it's interesting, once you start down the road of discussing aesthetics, you can go as far as hair. You can have the craziest discussions.
Yeah, I can imagine.
Yeah.
Eléna, it must be hugely rewarding, given what you're doing in aesthetic medicine, to see, as you were alluding to, Lara, the self-esteem come back. I mean, just explain a little bit about what it can do to one's self-confidence.
For me, it changes everything. I mean, it really is, as Madeleine was saying also before, you can have everything else perfect, your perfect hair and everything, but once you start speaking, if your teeth don't show what you would want to show out of yourself, it really can be a toll on your self-esteem, and actually fixing it. I mean, just when you see before and after pictures of cases, you can see how the patient changes. Sometimes they come to the before appointment and they don't have their hair done, or they don't have any makeup on, and they're like a bit of shame of smiling for the pictures, and then you take the after pictures, and like they come in and they try to arrange themselves, like, you know, like they do their hair, and they're super happy, and they smile, and I mean, it makes, for me, it makes a huge difference.
Yeah, I think that really changes. Sometimes they come back even happier, and you can see that in their eyes, how they shine, how happy they are.
I think you remove attention in the face.
Mhm. Yeah.
And people are aware or not happy, and they've adapted their smile to hide certain features, like a canine that sticks out, and they smile different. And suddenly you can just, it's a load off, and it's very rewarding. Huh?
I can imagine. Eléna, thanks so much for your input. Madeleine, I'm turning back to you now, because I want to touch on your specialism of orthodontics. Would you say we all need some kind of orthodontic treatment?
I think need is a very interesting question, because I think you can recommend, and again, the goal is for optimal aging and function. Well, optimal functioning, so you get optimal aging. But then I always tell my patients, if you don't do this, it doesn't mean your life expectancy is going to be shortened. Some of your teeth will have to bear a bit more load than what ideally they would be bearing. But I don't think it's fair. I don't do this. I don't think it's fair to say, well, you must have this treatment, or it's going to be a disaster. Some cases really are more severe, there's more arguments to stimulate somebody to embark. But I always say, and these are not my words, I borrowed them, and I've now taken them as mine, is that our patients they're not sick. Okay, they don't come in with like terrible pain, like cavities, they don't have, they're not sick. They come and it has more to do with function and aesthetics.
Yeah.
And of course, what is the advantages of a bite that functions well is that the teeth will work the way they are meant to work, and so they will age better. If they work differently from the ideal, you'll get more wear and tear on the teeth, and with problems in the long term.
Yeah, I mean there are so many different options available, aren't there, for those that do want orthodontic treatment. You used to just think about
You mean
braces.
options in types of
Yes,
braces?
exactly.
Yeah, there are. There's a lot of options out there. They basically fall into 3 categories. You can either, well, you can always do nothing,
Yes.
which is always an option, and keep what you've got and preserve that. And that is always an option I offer. And like you could also just prevent it from getting worse and wear a night guard and accept what you've got. And then there's outside braces, there's inside braces, and there's aligners. And then what? There's another category that goes with all 3 of those, and those are the surgical cases, what we call orthodontic cases. Those are people that have where it's the bony, it's not the teeth, it's the facial structure, the skeleton that's out of harmony or out of sync, where the top teeth and the bottom teeth don't fit together, or huge asymmetries, very big gummy smiles, where it's really the bony structure that needs to be addressed. And with that, we need to prepare before, during, and after with the appliances to make sure that when those bony structures are brought back into within norms,
Yes.
proportions, then the teeth fit together. So that's an other category, but that's independent of the type of brace.
Yeah, and there's lots of aesthetic sort of now.
Yeah,
procedures that you
I
can
think
use.
people want it fast and invisible,
Yes.
and I think that's what we all
Yeah.
want.
Magic.
Fast, invisible, cheap. And that's there was a thing on Facebook where you had these 3 things. You wanted amazing, fast, and not expensive. And you could never get all 3.
But now,
Well, you cannot.
that's right.
Still not.
Well, you can't have. If you want it to be amazing and fast, it's going to have a price, but that goes for everything. But then financing comes in, and
Yeah.
there's always ways to make something accessible. But yeah, we have when it comes to aesthetics, there's of course the white outside braces. Personally, I'm not a huge fan of them. I think that if they come in 2 materials, well, they come in 3 materials, but you have the sort of plastic type, and then you have the ceramic type. The ceramic can do damage to the top brackets, can do damage to the lower teeth. I'm not a huge fan. And I also don't think white braces stay very white. I don't think it looks very nice. But then you have the aligner type, and there's a very famous brand out there, which is also the one that we use, because they really are leaders in their field. If you're going to use that type of appliance, then they really, in my opinion, but I think we all agree with that, they are really, really great. For small things, we can now tweak ourselves, so that because of all the technology, we're getting increasingly better, and in the near future, we'll be able to do a lot of those funky aligners for small adjustments in-house. But aligners are great, very comfortable, they're very well marketed, it's a fully digital product. Again, in my opinion, I think they're great for certain cases. I would not, again, there's other people who feel differently, use that as my go-to tool to do a treatment on everybody or anybody. So the way I go about when patients come in, first of all, I ask them what is it they want, because between what they want and what I think they need, there sometimes is a difference.
Right.
So I think it's a very important conversation to have, and to maybe look for options, because especially in adults, I see a lot of adults. With kids it's easier, because I think the decision is to go for the best and for 100% correction whenever possible. With adults, there can sometimes be a compromise.
So in what cases would you sort of say no to an adult? What they might want would not meet what you feel like you can give them for whatever reason? In what case would that
Well, it's
happen?
very rare that we say no, because I mean there's always options, but I would say but we always find something, we always find a common ground.
Right, okay.
Yeah, I think it's just important to explain. I think it's when people come, I really, this tooth is bothering me, it's starting to move, can you fix it? And then you look and they're actually only biting on 4 molars. I think it's important to say that. Again, it's also important if they come in and they're 50 to say, well, you've gone this far, not doing anything for the next, it's not going to, again, shorten your lifespan, but you may start having some problems. But I think everybody, at the end of the day, people need to be in control of their health. And I think with adults that have gone many years with their dentition as it is, and they want an improvement, I think it is important to have realistic choices. And a lot of the time you can motivate them, say, well, I didn't know that I could still have a full correction. I thought I was just going to be like this forever. I didn't know that. I thought orthodontics was only for if I was growing or for younger. I'm too old for that, and it's dangerous, like moving my teeth because I've had some gum problems. It's not true. We can, if people with a history of gum problems or bone loss, we adapt the speed and the forces. So I think it's just it's a longer conversation with adults because there are a few more limitations, because we don't have growth, and maybe we have a history of some previous problems, or something we need to get under control before we can go ahead and move the teeth. But sometimes there are options, because to say that everybody needs to end up with a perfect bite, it's just not true. They need to have the information and be aware that their bite isn't aware and the risks in the long term. But if their quality of life changes so much and their self-confidence, because you're just putting that one tooth back in its place, then I think that's a valid option to give. Say, yes, I can solve that for you. You have all this other stuff going on. I recommend that you do it. I also understand that maybe that's not what you want, and you decide, or maybe you want to do it later on.
Yeah, interesting. And how much does the length of treatment vary for orthodontic treatment for adults?
So we didn't talk about my favorite.
Oh, yeah, I know.
No, because I've talked so much. The last but not least is the behind the teeth braces.
Of course.
And I personally believe fixed braces are the best option.
Right.
And
despite your favorite.
Yes.
Okay.
No, that's her
No,
favorite.
that's favorite, but the fixed braces behind the teeth, not the
yes.
ones on the front.
No,
Sorry.
and
Just
behind
to
the teeth,
clarify
because
that.
they are personalized, they're customized.
Yes.
So those treatments last a much shorter time period. Most treatments don't last beyond 18 months.
Right.
Whereas classic outside braces treatments that are not customized usually last about 2 years, 2.5 years.
And it's a great option for adults, isn't it, really?
But it's also a great option for teenagers, because I think anywhere from 13 onwards, kids are not, they have enough stuff going on physically to get their head around, and they're so mature nowadays. So I do it for any dentition, fully permanent, fully adult dentition. We offer it.
Is there a big difference in price between
aligners and behind the
yeah.
teeth braces? There isn't.
Really?
No. But between and any aesthetic option and regular metal outside braces, there is a difference.
Right. Okay.
It's about twice the price.
Yeah.
Yeah.
Okay.
But it's half the time, and it's something to consider.
Yeah. Are any orthodontic treatments permanent?
Nothing in our bodies is permanent. But as part of the orthodontic treatment, we have the retention. And the retention is basically what we put in place the day we remove the braces, whether they're outside, inside, or if they're aligners, it doesn't matter, is the retention protocol. And that is as important as, if not more important than the treatment. That can be either fixed with a wire that we place behind the front teeth, top and bottom, or it can be removable, which is very similar to a liner type. It's a transparent splint, night guard, whatever you want to call it. They do sometimes, the fixed ones can come loose, and so we now have a new protocol at the clinic where we do both.
Okay.
Because if anything happens to the wire, then you always have a key to keep things in place. Because you do, we do get emergencies. We get people coming in with, it's my wire, it's come through. It's usually the top, because it gets a lot more wear and tear, and the glue that holds it in place can just wear down. But without, so we need to keep the end result, the day we finish, in place for life. There's no treatment plan that is so great that it's puts the teeth in a stable position for the rest of your life. Because like we just said, our bodies change, our upper lip position changes, our muscle tone changes, our bone density changes, our skeleton has a turnover. The fact that if we clench and bite year after year after year, it has a forward push on the teeth, and so you get crowding. So we need to keep it in place forever.
Yeah, I was going to talk about teeth crowding. That's
the most common problem.
Yeah, is that a modern phenomenon? Because people talk about our mouth having got smaller as we've evolved, or
No,
is it genetic, or is it a mix of things?
Well, I think as we evolve, our jaw size, because of our diet, is getting more narrow, and our teeth size not necessarily. But the crowding that happens really is also a result of just the function. Our muscles are situated at the back of our jaws. We don't chew like that. There's always a forward push. Our teeth are arranged in an arch shape, and so if you get a little bit of movement, you lose some stability, and then you get a bit of a collapse or of crowding at the front. You won't get crowding at the back over time. It's very rare. Well, maybe if a wisdom tooth comes through, that's the only time. But you won't get spacing over time, except in a few exceptional cases. But the most common problem, and especially I now call it an effect of aging, the crowding at the front, because you can have your wisdom tooth removed and it still happens. So that's why we need to we put retention in always, forever.
And for anyone listening, because there's some debate about the best age to come and get orthodontic treatment as in adolescence.
I think it's always great. It's better to do it when you're young. First of all, underneath the age of 15, in most countries and most insurance companies will cover you. So that's one really nice thing. You're growing, so the tissues are just much more responsive. It's much easier to get tooth movement without having the risk of creating other problems. It's an age where kids adapt very easily. They don't, after a few days they don't feel it anymore.
There are others doing it, so they feel comfortable.
Yeah, and I think it's a very positive thing in your teenage years to have a nice smile, and that's why I love behind the teeth braces for teenagers, because they have all the other stuff going on, their skin and their nose and all kinds of other things that are growing or not growing the way they should be. And then if they at least don't have to hygiene, they don't have that metal work in their mouth. And I see it, and it's wonderful, because the biggest changes that happen aesthetically are the first 2-3 months. So usually whatever teeth were sticking out weird gets resolved the first 2-3 months, and because they're behind the teeth, then that's a real confidence booster, which I think is very positive. But there's no age limit. I think my oldest patient was 79. Yeah,
really?
Really nice guy, yeah.
And was that the first time that he'd had orthodontic
treatment? Yeah. He just had like that, the typical case of, my one tooth, it wasn't like that. And it was bothering his lip, which was very cute. So in those cases, we can only put a few brackets. Again, I work behind the teeth. And no, it was very nice. And yeah, so and it's possible. We just go a bit slower. You look at, you need to take into consideration the amount of periodontal support, so the tooth tissues around the teeth. But there's no age limit. We just need to, plan according to each patient, no matter what their age. And sometimes the other advantage of treating young is that you can probably just have the orthodontics. With adults, it's much more often a teamwork project where the orthodontic is part of the treatment, but there's some before, there's some after.
Great. It's so much to talk about. I've got myriad questions, but we've been chatting for quite a long
Forever.
time. So Madeleine, thanks so much. But I have one more question to ask all of you. So for anyone watching that wants one piece of advice to how to get the best looking teeth possible, starting with you, Madeleine, what would you say if you had to say one thing? I know I put you on the spot there.
Can we
have you got one?
I mean, one thing that can be applied to all, I'd say checkup and cleaning twice a year.
I didn't mention the cleaning twice a year because people think that just brushing is enough.
It depends on patients. Some patients don't require it every 6 months, and some patients require it every 3 months because they accumulate so fast. As a norm, checkup and cleanings every 6 months, and it prevents anything, and it allows us to have time to catch the problem early on and take care of it without it being too invasive. Exactly.
And you can combine it with the checkup often, can't you? Because people forget to do that.
I mean, at the clinic, we're the one performing the cleaning, so we always have an eye on also doing the checkup at the same time.
Yeah, that's important. We don't have dental hygienists doing it. We have the dentist doing the cleanings, because it's a really great opportunity to do
Exactly.
The checkup.
The checkup.
With you on at the same time.
Yeah.
Lara, what about you?
No, I would agree. The better the oral hygiene is, the less problems you're gonna have, and at the end, you're gonna have a better smile. I mean, of course, you might have other issues, but that would be the main thing I would address when it comes to.
Yeah, it's brushing after each meal,
Exactly.
floss, and go and get your teeth cleaned professionally twice a year as soon as from the adult age onward. Because there's always, we all get our teeth cleaned, you know, we know how to brush, but there's always places you can't get to.
Sure.
Yeah.
So that I would say that's, it should be part of everyone's routine.
Great. And perhaps don't underestimate the importance of a great smile.
Absolutely.
We all need to recognise that. We don't do that enough. On that note, perfect way to end. Thank you all so much for
Thank you
joining
for having
today.
us.
It's been really interesting. And we hope that you've enjoyed the Turó Talk face-to-face today and have learned something new and something useful about how to care for your all-important teeth. Well, if you want to find out more or book a dental or any other medical appointment at the Turó Medical Centre, you can go to the website, which is in many, many languages, and that website is turoparkmedical.com. And I believe that you're all also on social media, Instagram, Facebook,
Absolutely.
LinkedIn, the whole
Everywhere.
shebang. Great, that's it from us. We'll see you next time. Bye.
Thank you. Thank you.